Good morning. My name is Dolly England, she, her queen, and I am the interim equity director. And I have the privilege of being your meeting facilitator today. So welcome, welcome to you. Okay, next slide. Let us start our day, shall we? Our icebreaker is maybe click one more time. Tell us your name. Oh, this is different than mine. Okay. Did we do the intro? Can we go back one slide? All right. So, name, pronouns, organization, and the question is tell us about your favorite vacation destination. I'm not sure why it's not showing up on this slide, but that is the question for today's warm up. Tell us your favorite vacation destination in the chat. Name, pronouns, organization. Who's my co-hostess? Because I don't even know. Do I have a co-host today? Is it you,
I can be
Jessilia?
your co-host.
Okay, Jessilia. Hey,
Yeah.
good morning.
Hello.
Do you have a favorite vacation destination?
Anywhere near water
Mm.
and drinks with little umbrellas in them. I love a beach. I love it, love it. But also any place that has really great food, like known for good cuisine, like I'm there. How about you, Dolly? What's your favorite place?
I also like water, but since I'm trying to be frugal with budgets this biennium, uh I'm gonna pick some place closer to home and I'm gonna choose Parkdale. I love Parkdale. It is so magical if you haven't been to Parkdale in the gorge, and especially this time of year with all of the fruits popping off, getting ready to be ripe. Uh, the Fruit Loop is one of the best places for me. So we welcome you all to put your thoughts into the chat. Seeing some good answers come in here.
This is a really good, I mean, we're at the beginning of spring and this is just like really good ideas to plan out your spring summer vacation just with everybody's great places that's dropped in the chat.
Um, I think Sharif, just so you know, we can see your chat. Going to the next screen. Our agenda, manager fiscal updates. We'll talk to you about your events because that's what we do. And then our friends from the Read group are here today, and they're gonna share some findings about, get this, your work. So we're really excited to be able to share that information back with you today. All right, next slide. Just Leah, I'm a hand because if y'all didn't know this, let me say it again. Josilia is now the community engagement team manager. I, Dolly, am no longer the community engagement team manager. I, Dolly, have passed the baton over to Josilia, who is now the community engagement team manager. So if you email me some question or something and I don't respond, it's because I'm forwarding it to Josilia, who's now going to be managing. Okay, Josilia, handing it to you.
Thank you, Zali. Hello, my name is Justilia. Um, I'm one of the managers on the team, and let's do some updates. So, the first thing that is up there is for reporting. Reporting is past due. If you are having issues submitting your reporting, this is reporting that was supposed to capture your activities from January through March. So if you have not turned that in and you need help, please reach out to your CEC because that is now very, very late. Extension award letters for most of you, your CEC has sent you an email. And that email is full of information about your award for the extension period, and information about next steps, including submitting a work plan and submitting a budget during the extension period. If you in the award letter, today is the day, the due date to let us know if you're going to ride with us for another 6 months or if you are going to stop and end your contract in June. So if you have not seen that, if this is news to you, please look for an email from your CEC or search extension in your inbox so you can find that email and respond back with if you're going to accept the award or decline it. We need that information so we can start getting your paperwork together. That paperwork is your extension amendment from Tammy Hurst. So Tammy will send your contract amendment once everything is processed. So that contract amendment will go to your organization's signatory. So just that's your next step. And then secondly, in the award letter, in the email, we have a work plan and budget submission request for you all that's due on the 31st. And if you need any assistance, if you need any help, please reach out to your CEC for any questions that you might have. And I am just now seeing the chat, and thank you everybody for all the love. I appreciate it. Dolly has been just an amazing manager and an amazing leader to have as my boss for like what now 4 years, and so I'm very grateful to have someone like as incredible as her leading the way. And yeah. My inbox is a little bit out of control right now, so if you don't hear from me immediately, I will get back to you. And with that, I will pass it back to over to Zach for fiscal updates.
Hi, hey, hello, good morning, everybody. Zach Owens, he, him pronouns, resident fiscal dude supporting these efforts. Um, sorry, sorry about payments. April payments were a little bit delayed, but they should have, they should now be in accounts by today, I think, at the latest. So they should be there, and May payments are back on track. So we expect those to be issued either towards the end of this month or the first week of June. So sorry for that snafu. Bit busy, back on track. Um, as Josilia was talking about the extension award letters that went out, just want to note that within those award letters, there are links to the budget templates for that 6 month extension period. And those budget templates can also be found on our website. But yeah, the award letter has everything you need to figure out all the pieces, including those budget template links. And just as a reminder, the budgets do need to align with the extension award amounts by program element. So if you're receiving funds in more than one program element, that means that you need to have your budgets broken out by those program elements. And that's pretty much all I've got for today.
Thank you, fiscal dude. Okay, so now we're on to the events portion, and it seems like my team is super smart and created a link for you to share all of the events that you might be doing. So if you'll notice, we're gonna hype the events that you send us, and we when we don't know that your event is happening, then we can't hype it for you. So, Justin, share the link if you want to share your events with us so we can hype them for you. Then I'm going to ask you to fill out that smart sheet link. We do have two events that I'll highlight. Shiloh, I see your hand.
Question for Zach.
Ooh, yes.
On the new budgets with the extended money, that is added to the budget prior, correct? For a total? Or is it its own separate budget?
So it's its own separate budget. Thank you for asking that. Because we have all your budgets through June, basically now. We have that tracked. So we're just asking you to give us the budget for the 6 month period as a standalone.
Okay, so thank you for that. My second question is then, if we have remaining funds on the budget, on the funds that are up till June, are those extended on until the 31st, or is that the deadline is June 30th for the spin down? Did my question make sense? Did I say that right?
Yes, it makes sense. I'm thinking how to answer it carefully because you will definitely have that for, yes, you will have until December 31st to spend all the funds of your grant.
Okay, okay. So then my third question, I apologize, but if I'm doing a separate budget for this, then the does that amount awarded get added to the expenditure report budget? And then all
Mm.
of the funds are still documented in the same expenditure report, correct? Or is that going to be another one from July 1st to December?
I
Or
still got
just
to
go
figure
on for
that
the
out
quarters
because we don't have an expenditure report right now that
report?
has those additional 2 quarters. So
Yeah.
we'll have clear direction on that here pretty
Okay,
soon.
that makes sense. I'm sorry, I didn't even think about that part, that it's continued quarters. Just overthinking things.
No,
Thank
you're
you.
asking great questions, and I'm sure a lot of people, if they aren't already having those questions, will.
Yes, thank you so much.
Okay, people are popping off. Okay, now the questions are coming. I'm going to go to the question in the chat, then we're going to go Alejandro and then Karima. What if we received an award letter only for one of the program elements? Do we need to check with our CEC?
Yeah, if after reading the award letter and you think it's odd or you don't understand why you didn't get an award, um, then you should coordinate with your CEC. I will say the big shift here to note on the extension is that a lot of you received supplemental funding through the Public Health Infrastructure Grant over the past 18 or so months. That is PE 5007, and that is a federal funding source. And we made a conscious decision to not utilize that funding for the extension period, just with the uncertainty around federal funds, and instead we supplemented that with either modernization or tobacco funding, depending on what program areas you're working in. So that might be the case as to if you're like, well, I was getting 5007 and 5002, and now I'm only getting 5002. That's correct, but the amount is increased to try and keep you whole. It's just a different funding source. And if that confused the heck out of you, just ignore what I said. But if you have questions, ask your CEC.
Okay, Alejandro.
Sí, la pregunta era
My
si la
question is,
extensión
if
es
the extension is
por 6 meses
for
y
6 months
el grant original
a-
era
and the
por un
original
año,
grant was for 1 year,
el budget pudiera
is
ser la
could the
mitad
budget be
del
half
budget original, porque
of the
son
original budget
la mitad del tiempo. ¿Eso
because
sería
it's
correcto?
half of the time? Would that be precise?
El contrato que usted recibió fue de 17 meses. Entonces,
Ok.
el primer contrato que usted recibió, su award se dividió por esos 17 meses y así calculamos el pago. Entonces, para los 6 meses, lo que hicimos es tratar de mantener el mismo pago, para esos 6 meses. Entonces, su pago sería el monto que le dimos dividido por los 6 meses y ese va a ser su pago de julio a diciembre.
Perfecto, pero hay una pregunta. Hay pagos que son, ok, ya entiendo, el pago va a ser
I
el mismo
understand that, but the
que
payment
se ha hecho
will
hasta
be the
ahora,
same.
pero
done
seis
until
veces más
now,
repetido en los 6 meses que quedan. Es así, ¿no?
but it's going to
Correcto,
be
sí.
repeated for the
Perfecto.
next
Y
6
después
months
entonces nosotros tendremos que
until
distribuirlo
December.
dependiendo de los
So we
diferentes
have to
ítems del
distribute
budget.
it according to different items on the budget, correct?
No, no
Por
capturé la
ejemplo,
pregunta.
el pago de un mes,
For
Ujú.
example, the
nosotros
payment for a month,
digamos, lo dividimos en los pagos para las personas
we
que trabajan en
will
el proyecto
distribute it
y
throughout
también una parte
the month
venida
for the people working
a
in the
las tarjetas
project,
de
and we
incentivo.
allocate part of it for the
Igualmente, eso
incentive
se va a hacer
cards.
en el budget
So we will
vaya
do the
metido también
same so that it's included.
ese elemento que son las tarjetas de incentivo también.
The
Correcto.
incentive cards should be included as well, right?
Gracias.
Thank you.
Do you want me to translate that for everybody in case somebody
Yes,
has the
and I
same
want to
question?
remind people that we do have translation available. So if I realized halfway through that I wasn't in the English room, so if you go down to the three dots, you can select your room with translations.
So Alejandro asked essentially how if the first contract, the award amount was divided by a year, and it was not. So the first contract, your award amount, if your cohort two was divided by 17 months. And so that's how the payments were calculated. So your award amount by 17 months. And then we, again, like Zach mentioned, try to keep you at the same level payment. And so for the 6 months, your award will be divided by those 6 months and keep you at more or less the same payment for the 6 months. And then the question was if he captures kind of the salary payments to or the payments to staff as well as gift card payments or gift card expenses in the budget. And the answer is yes. So in your new budget that you'll be submitting, you'll again want to use the line items for salaries, equipment, gift cards, anything else that you're expected to expense the 6 months with your award amount.
Thank you for that question, Alejandro, and thank you for your help, Leanne. Karima.
Yes, ma'am. Zach, Shiloh asked the question about the budget. So we have currently, as of June 31st, an underspent in one of our line items. Can you or can you not tell me, as we prepare the budget for the next 6 months, can we transfer that underspend into the next 6 months budget? Or shall you receive a report at the end of June 31st saying we have an underspend here, and then we can use it in the new budget? I'm sorry if I'm confusing. I'm not the bookkeeper. I'm trying to think for it.
No, thank you for that question. That to me makes sense. And um, what we're asking for right now is just a budget that aligns with um, that 6 month award that we're offering. And so it would be more of the second option of what you're saying, where at the end of after we look at the expense report through the end of June and see kind of what's left there, then it would make sense to, I don't know if we'll formally ask you to add it to your budget or not. And practically, totally, it makes sense for you and your organization. Make sure you are keeping track of all the monies and that you're spending them all down. But what we're asking for right now is just a budget for that specific award amount that we're offering for 6 months.
Okay, perfect. That's very clear. I'll share that with the bookkeeper, and if he has any further question, I will let you all know.
Thank
Thanks,
you.
Zach.
Thank you, everyone, for the great questions. You know, we're always here to be able to support those questions. Shiloh.
Okay, gave me another question. Okay, so if I get to the end of the 6 months and I'm looking at what has not been spent, can we do an amended budget and reallocate those funds for the extension of the 6 months? Since we can spend it down, can we reallocate it? So basically, trying to say this without like airing too much of our own personal, but or say we have a whole lot of funds in one spot that we don't really see us spending that, but we could use it in other places. And it might become more than the 25% of that amount in that pocket. Can we do an amended budget? Or do we need to?
Um, the short answer is yes, that you can reallocate funds to make sure that they're spent. Do you need to be cognizant of that staying within that? Basically, if it's a big shift, we use the 25% as the marker, but if it's a big shift, then that's where we want to know about it and be able to
Okay.
have you run it through us for approval. And if you have questions, if you're, I would say ask your CEC just directly to just make sure. Um, but again, so long as it's within the same program area, if your plan has changed, but you have a plan to spend the money and it supports your grant activities, we want you to do that.
Right. Well, and I think when I think about it, if we're going to extend it out through December, then in that pocket, we probably are going to spend a lot more of it. So if we're still seeing kind of a big chunk in that pocket come the end of June, we still want to project it out till the 20 or till the December. So we wouldn't want to move too much. So I see what you're saying. If it's not a huge amount, then go ahead and allocate it how we have to.
Yeah, and I will, these questions are kind of good feedback for me about thinking through the practical, uh, just trying to handle these bu different buckets of money in the different time periods. And I'll give some thought to if I could maybe come up with a tool that might make it just a little more clear to make sure that we're all on the same page. Because I know that operationally it is going to be a little bit wonky to have, yeah, we've got a budget through June, we've got a budget for these 6 months, here are actuals, how are we reconciling all of it? So I'll give that some more thought. But
Yeah, well, and I
yeah,
think for on our end, at least for myself, when I look at the expenditure report and I see an approved budget, right, that you guys have approved, and I'm going a little over here and I'm going under here, I'm a little nervous about that, like, but then I get the answer, well, if it's not over 25%, go ahead and allocate how you have to, but then it doesn't match the budget. And so then it throws me into that whole like, do I need to amend something? Do I need to change something so that because it matches the work plan, you know what I mean? And so like, am I making sense? Like, I think that I just get that in my head that I have to really focus on matching that approved budget in the expenditure report.
Yeah. Can I just step in? Sharif, can we just stop sharing screen right now? I don't think we need it anymore. And
I
I'm gonna
apologize,
say out
Dolly.
loud that if you want to make changes on your budget that are more than 20%, we will likely work with you. And that is absolutely a reason to reach out to your CEC.
Yep.
So that would be the next step regardless. And then Zach and Joselia are going to be in the mix regardless
Okay.
to give you that one-on-one guidance. But to your point, Zach, this has been a really important conversation. And I see Felicia's hand up as well.
Apologize to take so much time. Thank you.
Hi, I'm Felicia. I'm from the Portland Open Bible Community Pantry. And my question is, if there are community-based organizations who are not accepting their funds, is there a way for their allocated funds to be dispersed to the CBOs who might have been underfunded or who might request more funds?
I'm going to tell you, sure. And no one has said, I don't want my money.
Okay.
Just keeping it real
That's
with
that's
you.
good. That's good.
Yeah.
no, I also think that brings up a good point, and I may be overstepping, so Dolly or Jacilia, you can chime in here. But in the past, we have not entertained requests for more funding. We do not have more funding to give out. So I think, have done our best to try and make things as whole as we can. And if you have feel free to bring up a specific concern with the CEC, but I just want to call that out that that's not usually how it works.
Got it. I appreciate you all not holding anything back from us.
I also want to just jump in and say, thank you for your questions. It lets us know that you're looking at these things and thinking about it and just trying to make sure that everything is like tight for your books, your personal books, and for us. I just kind of want to just kind of not wrap things up. If you have more questions, please don't hesitate to raise your hand or put them in the chat, but just so that we're all on the same page with everything. So if you have existing funds right now, you do not have to try and rush to spend those down before June 30th. Okay? You are fine. Just continue as you were. You are fine. As Zach mentioned, we will come up with a way to make sure that everything gets reconciled. But for right now, you don't have to rush to spend those down. Secondly, your award, the amount in your award letter and your budget, just saying it again, please make sure those are matched when you send those back. Please don't say, oh, we still have 20,000. Should I add it to this budget for the extension period? Please don't do that. Please just send what's in your award letter. Make sure those things are aligned. And and then if you are looking at, like Shiloh asked a really great question. Shiloh said, okay, we have some things that we want to move around that's going to exceed the 25%, right? Um, some budgets are your best guess, right? Like when you sent those budgets in at the very beginning of this grant, things do change, right? So please, if it's going to exceed the 25%, reach out to your CEC so that they can bring in program staff or bring in Zach if it's needed to make sure that any changes are going to be okay. It's just a conversation. It's an email. Just send it to your CEC. Hey, we're interested in making these changes. We want to just get that process going. Can we have a conversation? Do I need to talk to the program staff? Your CEC is your first point of contact for that. If it's under 25%, you can make those changes and then send that budget to your CEC and just say, we made some changes. Here they are. It was underneath the 25%. I just want to make sure you have the most updated budget on file for us. Okay. Good stuff. All right.
And we are still on schedule to introduce our friends from Read Group. And so, Autumn, can I introduce you and will you introduce everyone else? Or is it Jill? Jill. Hi, Jill.
Hi, Dolly. I'm so happy to be here with you today. I'm looking for Autumn. Autumn. Oh, there
I'm
she
over here.
is.
Hey.
Hi, everyone. I'm Jill Hudson with the Read Group. My pronouns are she, her. I'm pleased to introduce Autumn Decker, who will be sharing back results from ripple effects mapping.
Yeah, thank you. Let me get my screen up to share here.
Mhm.
I think after all this time, we'd be all set for it. Here we go. Okay. So, does that look okay? We can see that? Awesome. All right. Yeah. Good morning, everyone. As Jill said, my name is Autumn. I am a consultant at the Read Group. My pronouns are she, her. And We are very excited to share some really great results from our evaluation of the Public Health Equity Fund. And we will specifically today be focused on the ripple effects mapping portion of this evaluation, which I'll talk a little bit about and introduce that specific methodology. Um, so we are from the Reed Group. We are a social impact company that does evaluation work across a whole host of different populations and concepts and outcomes. And we're contracted with OHA to provide an evaluation of the Public Health Equity Fund grant that you all have received. So you may have seen us, you may have got some emails from us, you may have participated in some of our evaluation. So some of this might look a little familiar, some might look a little new, but we are really excited to share some of the really awesome work we've been able to find, your awesome work. So I just wanted to give a kind of quick overview of the different types of data collection that we've been doing as part of this evaluation. So I mentioned this ripple effects mapping, which is what we'll be focusing on today. We also conducted journey mapping. These were interviews with cohort 2 CBOs to talk about the experience of becoming a Public Health Equity Fund grantee. We also did a ripple effects mapping with OHA staff, and we'll be marrying that in with the results from the ripple effects mapping that was done with CBOs. So we'll today only be focusing on the CBO ripple effects mapping. We also did some focus groups with OHA staff and have grant reports from the activity reports and expense reports that you have all been submitting over time. We are also doing an analysis of those. So as I go through this today, I do want to drop two questions in the chat. Of course, there we go. There's the chat.
I got
So,
it in there, Autumn.
oh, awesome. Thanks, Jill. So we have these two questions here. So as I'm going through the results today, I want you to just think about these kind of guiding questions. So first, as you hear about these preliminary results from the ripple effects mapping, what sticks out to you as the most important? And are there any aspects here that surprise you or maybe seem unexpected from these results? So I'm just putting those questions out there. So as I'm going through these results today, you can kind of have those as some guiding questions. And at the end, we'll kind of have a little bit of time to come back to maybe get a couple of responses from you all on those questions. So what is ripple effects mapping? So the purpose of ripple effects mapping is to identify and visualize the direct and indirect impacts of a program or initiative, and really helps to highlight strengths, areas for improvement, and any unexpected outcomes that came out of this. So it really uses this idea of you throw a rock into water. Imagine you're throwing a rock into water, and eventually you can't see that rock anymore, but it creates these waves, these ripples that continue out. So in this example, your work is the rock, and those ripples are the effects of your work. So we're really trying to understand those effects. And this is a little bit of a different evaluation method than traditional evaluation because it really is very interactive and focuses on positive storytelling. So we had the opportunity to conduct 3 ripple effects mapping data collection sessions. We had 2 online and 1 in person. So what you're seeing here is a breakdown of the CBOs that participated in this part of our evaluation. So we did ripple effects mapping with cohort 1 participants from the Public Health Equity Fund. We had the opportunity to hear from 23 different CBOs and had a really nice spread of the participation across the 5 regions here on this left side of this picture, you can see the different regions, and that corresponds to the percentage of people who participated from that. So it was a really nice even spread. It was really great to see that in our participants. And then on the right side, you can see the populations that were served by the CBOs that participated in terms of a percentage of of the total 23 CBOs. You can see what that kind of breakdown looks like. We had a nice wide range of populations served by our CBOs. So I know you probably can't read this, and that's okay. I just wanted to share with you what it looked like when we had these ripple effects mapping events. So what happened was our CBOs were paired together and they got a chance to chat with each other, a one-on-one, two CBOs each group. They got a chance to talk about their work together and kind of interview each other with this really appreciative and positive tone. And then we all came back together as a group, and each CBO had the opportunity to share what the impacts of their work have been. And this was facilitated by another consultant at Reed who asked some probing questions, got a little bit more information from the CBOs. And I was the one who was live mapping this on this awesome software that created this colorful map that has all this information from the impacts of your work. So we took all of that, all these recorded stories, and we entered them into a qualitative analysis software. And then we spent time looking through all of those and came up with major themes and sub-themes across all of these stories. So things that were really coming out of this work. And that's what I'm going to be continuing to talk about today. So what you're seeing here is a visualization depicting the major findings from the analysis of the ripple effects mapping. So you're seeing from this first arrow out from the Public Health Equity Fund grant results, with this first arrow out, these are our major themes: community-driven work, expanded services, improved collaboration. And the next arrows out are kind of examples and sub-themes of that major finding. So for the purposes of our presentation today, I'm going to be focusing on these three outcomes specifically. That would be expanded services, improved collaboration. Sorry, I'm getting dry already. And improved capacity building and sustainability. And that's just as a result of time. And I think that these will be I'm excited to share this. The other three that are not going to be a part of this will be part of our final report. And those themes and information will be available, but we wanted to focus in on these three specific ones today. But I am happy to answer any questions about those other themes if they do come up for you. So I'm going to start with improved collaboration. So this is there were three kind of buckets that came out related to collaboration. CBOs mentioned the opportunity to partner with other CBOs that had different skills or were serving different populations, that CBO maybe wasn't a priority population for them, or maybe they didn't have the skills like or language capabilities or capacities as other CBOs. So a lot of CBOs talked about that opportunity to have improved collaboration with others that has led to some really impressive and impactful outcomes. They also mentioned a few of them, some improved relationships, working relationships with LPHAs as part of the Public Health Equity Fund grant. Many talked about schools, universities, local businesses, and people, and having some collaborations, new collaborations with those. Some CBOs were bringing programs into schools and working on school relationships. So, really fostering those relationships with schools, building that trust, and being able to reach students and families, caregivers within schools as well. At least two CBOs out of the 23 that we were able to talk to talked about establishing internship programs with local universities, which is awesome to hear. So we thought that was really quite impactful. You can see on the right here on this slide, these are direct quotes from CBOs that participated. So that first one, we were able to partner with some different organizations that were bringing their youth outside of our network and introducing them to the idea of advocacy. So that's getting at that improved CBO relationships. And then the other quote here, we've taken advantage of being so close to OSU, having interns from their public health program and being able to support those interns as well. And then several also mentioned partnering with local businesses, farmers, food providers, and just kind of key people in the communities as well. And then lastly, with collaboration, there was an emphasis on improved collaboration with professional or government organizations. There were several organizations that were working with national things like the Red Cross, some local governmental organizations like TriMet providing free rides and access to TriMet, and then also working with the Oregon legislature specifically. So those were kind of the themes and sub-themes and examples around improved collaboration. I'm going to move to expanded services. So this really came out in three major ways: expanding to new locations, expanding the public health services that CBOs were offering, and expanding into new populations as well. So CBO shared that with this funding, they were able to expand their reach into new previously unserved counties by that CBO. So you can see here on the right, this first quote, through our tobacco prevention, we got a chance to expand and strengthen our staff, and we were able to deliver services not only in metro areas, but also expand to two new counties as well. And there was some examples of expanding services statewide or shoring up existing statewide services. There were also quite a few examples of new public health services. This means expanding topics from maybe their traditional focus of the CBO to a different topic. Often this was maybe they were previously focused on tobacco prevention, but started getting into emergency preparedness, climate adaptation, food sovereignty, a whole host of kind of new topics that were coming out and new work for CBOs. And this also included expanding services based on community identified needs. This could have maybe come from a community assessment, a community needs assessment, or in just conversations with or listening sessions, things like that. They found out a need in the community and shifted resources and efforts to focus on that specific service. And then lastly was new populations. Some CBOs also began serving new priority populations. For one example, specifically, one CBO started focusing on undocumented immigrants and offering support for those populations. And being really just having the flexibility to change population focus based on the context of the community, society in general, all of those things. And many CBOs also started having new linguistic offerings, serving new languages, new populations. So that was great to see as well. This other quote here. We started working with African American and African immigrant farmers, and we started reaching out to Indigenous farmers as well. We're going to create this network and market so we can do that building. We are trying to be on the forefront of all of these things. You can just see that expansion into serving new areas and working with new people. And then the last thing I want to share with you all on these themes is the improved capacity building and sustainability that happened for CBOs. And this included kind of three major buckets here. The first was skill building. A lot of CBOs shared that there were increased opportunities for staff to attend trainings or conferences. Some of these things were OHA provided resources and trainings, and some of these were external things that they were able to start doing. Some CBOs are presenting at conferences their work, sharing back out the things that they have done and the successes that they have had. So we saw a lot of that. There also was improved capacity in building and sustainability related to increasing or sustaining staffing, which follows. There was better staff capacity to deliver programs and services and to make connections. This quote here on the top really stuck out to me when I was reading through all of this and doing this analysis. The CBO shared, we've had organizations who have reached out for advice and help, and it's just that we wouldn't have had the capacity to have those meetings with them if we didn't have a little bit of extra funding. We would have had to been like, nope, this funding is only for the event. That's all we can do. I can't meet with you. I can't include you. We just don't have the capacity. But this funding gave us that capacity. It was just awesome to see that coming through. And also tangibly hiring more staff or making staff permanent from this funding. And lastly was CBOs did share some organizational and infrastructure improvements that they were able to do. Some of this was through OHA provided resources and connections like website building and updates with creating videos and marketing strategies, storytelling, things like that. And then there was also there was mention of organizational structures and marketing opportunities that helped also to kind of change the structure of the organization itself, whether that meant kind of shifting things around, bringing in a community advisory board, those types of things to be able to better respond to the variety of community needs. And I want to end this before I kind of open it up for questions, reactions, all of these things with this last quote here. They're not just interested in pushing down funds, them being OHA, but actually building the capacity of the organization, supporting the organization and their work, not just throwing money at them, but also, again, supporting them in a meaningful way that a lot of organizations struggle with, especially the smaller ones. With that,
Adam, I'm going to interrupt you for just a second.
please.
I know we're doing kind of okay on time. Dr. Sandra has a question for you.
Okay.
And if you don't have this right off the top of your head, I've noted that we'll follow up later. The question is there more information you could share regarding the partnerships established for internships with universities?
That is a great question. I don't have any specifics of how they did that or anything like that. I would be able to look back through and see what it was that they shared about with that. I know that they shared maybe some of the tasks that interns were doing and things like that. I don't know any of the ins and outs of how they established that program. But I can look back and see what that CBO did share and get that back out to you.
This is Dolly. If that's a topic people are interested in, we can certainly look at inviting that CBO to come and share. I think it's probably someone in Union County. I know they were working with Eastern Oregon, and I think someone's working with OSU as well. So I know it's happening.
Awesome. So with that, I am going to stop sharing my screen so I can see you all. We have those questions in the chat. Before that, I do want to share that we will be sending out this in a PDF form. So if right now is not maybe the best time for you to be rattling off impressions and reactions and all those things, and you want to sit with this information, we will be providing that. And I think maybe Josilia, you'll be sending that out to everyone in attendance. But we have a couple more minutes here, so I want to open it up to any other thoughts, questions, reactions from anyone else.
Adam, I just want to say, like, just thank you to you and Jill and your whole team for leading this process. I know I'm for one, and maybe others in the room too. I'm really excited to see that one image that was really tiny, but you could visually see all of the ripples that came out from that core question or that core topic. Love to see that just when that's ready, and I'm excited to share it out. Jody will send a follow-up to the whole group here and all the funded partners with the document that you share. So thank you.
Josilia, can I just say one more thing really quick? I know there are several people in this meeting today who have been on this entire journey, and I just want to reflect back that um, this is an evaluation that many of you worked really hard to design. So, hearkening back to last spring and summer, where we were literally meeting every week and people were just you, a subset of you, were just putting in the effort to define the questions, to define the methods, just showing up to design this evaluation. And I wish you could be in my head when we get to see all these results come through because it's amazing. So I just shout out to those of you who are finally seeing this evaluation come to fruition. And I want to thank you again for all the work that you put in.
Dr. Sandra, I see your hand.
Hey, Dolly, everyone, Josilia. Um, Again, it's great to see that. And as Josilia just mentioned, when we see that map, it's like, oh my gosh, I want to see that really better and understand it. And one other thing, besides everything, thinking about these ripple effects of what we have been getting in monies and what we've been able to implement, it could be even much bigger than what you could get. I saw that we were 23 organizations there, and I'm really trying to remember if Doulas Latinas is there because if somebody participated, I can't recall myself because there's been so many surveys and things that we had done for the past few months, and all of them are important. So my point would be I don't know if I doesn't matter what we did, it was an amazing. And I would suggest Dolly, Josita, and everyone, if possible, to repeat that uh, in maybe 6 months or I don't know for next year, because I know we have to have monies to do that. But I think it's very much valuable because that will support everything and all advocacy, not just for money, but to keep the program going, the equity funds and everything we are doing. Thank you.
I'm glad you mentioned that. And what I want you to know is we're going to continue to be sharing data back with you over the next couple of months between our partnership with Reed Group, Leslie and I and team have been working on an assessment that we're going to hopefully share back with you soon as well about how you've worked with NAO. We know that the work we're doing is important, and more importantly, that it's working, that it's making change. And so we are going to be sharing that out and making it accessible for you all too, so that you can continue to share and show how your work is a part of a bigger picture, you know? Mercy, I see your hand.
Good morning, and good morning to everyone. I just want to say thanks to the regroup because I know I'm one of your big critics about why do you do survey and you don't tell people how it went. So I really want to say thank you. But one other thing is to know from Dolly and her group, is this what you really expected? How do you feel about the report, about what is actually going on with CBOs and the work they are doing? Is it what you expected, or what was your reaction?
Blown
I,
away.
yeah, I
Blown
mean,
away.
I feel like I already knew and now I have proof.
Hmm.
That's how I feel. I
Yeah.
already knew and now I got the proof.
Yeah. Well, thank you. I just asked that question because I know that during the Ebola time, I know those times are different from today. We requested a space just to be in this way so that when anything was happening, we could come back together. And you did not just provide us space, but you also continue to give us funding, whether it is $2 or $3, just to keep us in the mess. But that is a great job. So I also just wanted to say thank you for the entire process. I mean, just the equity fund alone just keep us going. And like I told them, it allows other organizations to see us and to support our work. So I don't really like um, there was a Felicia Brown that asked a question like, "Hey, if I don't want my money, if I can I give it to someone that is not really receiving enough money? Hey, do you not want your money? Give it to me." But anyway, I don't want the money. Just donate it to Mercy, and I would take it. But it's not just about the amount; it's about just being in a community space and making sure that you're making um, space for your community members to come together once a month or something or somewhere they can come and know that they can get some answer. So I really appreciate this space. Thank you for everything that you do for us. And we pray that one day things will really be so much better that we can get $150,000 or $200,000, to just make sure that our effort and everything is being appreciated more. Thank you for your space.
And on that note, we're gonna put it into the universe that we're just giving people 150, $200,000 here and there. Let's just put it into the universe. What a good way to end a Friday. Read group, we appreciate you for being here and sharing back this data. Hopefully we can send a follow-up email with some copies of these reports so that folks can have access to them. We appreciate each and every one of you. I hope you have a wonderful and restful weekend. Take care, everyone.
Bye, y'all.